Hi, I'm Dr. Chrissy Elrod, a licensed therapist with a PhD and a breast cancer survivor with PTSD. Today, I'm talking about medical trauma again and how we are socialized to medicine. I grew up as a really sick kid. I had terrible asthma and was in and out of doctor's offices and the hospital quite often. But even all of us from a young age, we are told how to behave when we go to the doctor. So I had quite a bit of experience going to the doctor as a kid, but all of us, we are taught how you're supposed to behave when you go to the doctor's office. We're asked to accept painful, sometimes medical treatment, but it leads to our health and healing. So even if that medication tastes bad, we swallow it anyway. We know that shots and needles hurt just for a second, but we tell our children not to be afraid because we need the medicine. As adults, we have a lifetime of this direct and indirect socialization that puts the patient kind of in the vulnerable position and the provider in the powerful position. As the patient, we're expected to be very vulnerable and also grateful for the treatment that we're receiving, even if we're totally uncomfortable. So, children luckily have the National Child Traumatic Stress Network that specifically helps manage pediatric medical trauma. But adults are really only more recently coming out to talk about their fear, their experiences, and the trauma that they've experienced. I specifically got PTSD from the perfectly executed medical treatment that was necessary and life-saving. So it's important for adults to start talking about their experiences a little bit more so that we can bring awareness to medical trauma. Because we've all been socialized to behave quietly, be vulnerable, and allow providers to treat us in whatever painful or uncomfortable ways that they need to, and be grateful about it. So let's start talking about our medical experiences and bring more awareness to medical trauma.